When nurse practitioner Tarek Khan ends his day seeing patients,
oh, we're fine, okay.
If he finds any leftover COVID vaccine, he's out the door, in his car.
We're coming over now for your shot.
On the road making house calls.
They've been trying to get this shot for so long. You have no idea what this means to them.
I'm excited.
Linda Timmons is one of more than 80 homebound Philadelphians.
All right, here we go.
Khan vaccinated, all with doses drawn for people who scheduled an appointment but never showed up. He's carrying Moderna vaccine. From the time it's drawn, clinics everywhere have just 6 hours to inject it before it spoils.
Once that time is up, that bottle gets thrown out.
Dr. Lenore Asbell is one of the Philadelphia public health workers overseeing a mass vaccination clinic.
How do you explain to somebody who's been waiting for months to get vaccinated that you're throwing away vaccine?
So again, it is a very rare thing, but if somebody had an appointment, one of the things I think that the public can help is if you have an appointment, don't not come.
In Philly, the Department of Health's records show out of more than 500,000 shots, just 124 vaccinations were wasted. Across Pennsylvania, more than 3.2 million shots have been injected. The State Department of Health says 2,184 vaccinations were tossed. They blame broken vials, bent needles, and doses drawn for patients who never showed up. In New Jersey, the State Department of Health didn't respond to our questions about wasted doses.
I'm surprised we're not wasting as many.
And from Delaware, the state's medical director tells us he's aware of just 17 wasted doses. That's out of more than 433,000 shots.
Some of it would be just like I just couldn't find another arm.
But we found the way some health departments count vaccine waste may mean that they're lowballing how much is actually being wasted. Some health departments don't even know a dose exists unless it's injected.
Take Philadelphia's health department. It assumes every Moderna vial holds exactly 10 doses, but admits sometimes doctors and nurses get an 11th or 12th dose out. That means if one of those extra doses is drawn and wasted, no one would know.
I don't think that they have the resources to track these down at this point. You know, later on, it's possible they'll look back.
Those getting a shot,
I'm so glad,
didn't care where it came from.
1, 2, and 3.
No one we visited knew their first dose was nearly thrown away.
I'll see you in 4 weeks, okay?
Okay.
All right, God bless. Thank you. Bye-bye.
For the investigators, I'm Mitch Blacher, NBC10 News.
The CDC couldn't tell us how many COVID shots have expired and been tossed across the country. The CDC doesn't have a baseline for an expected or acceptable amount of wasted vaccine.